Hi, it's Jenny D, and Breast Cancer Awareness Month. We call it OctoBRA here. We have Mammogram Mondays. We want to just kind of really raise that awareness and get you into action to scheduling your mammogram, being your own advocate. Here to help us today, Dr. Coley from Cherry Creek Heart in Aurora, accepting new patients. Also, you've of course seen her on 9 News and all over. She's an expert. And so let's talk about this because this is something I've been hearing from a lot of people this month. Why are younger women getting breast cancer?
It is a very concerning trend. So cancer, if you think about it, is really a disease of aging. Mm-hmm. Our cells get DNA mutations that they can't correct, and that's what causes cancer. And we're getting this phenomenon of accelerated aging happening in a younger population. And we think a lot of it has to do with exposures earlier in life. And so if you think about our younger women, what types of things are they being exposed to? They're being exposed to cosmetics and chemicals through the skin and through the environment, some of which we maybe don't quite understand, perhaps even through the foods. Mm-hmm. They're being exposed to certain toxins that can cause DNA damage. They're certainly being exposed to alcohol. So we know that the younger generation tends to drink more, and we know that women have started drinking more over the years to keep up with the boys. Mm-hmm. And because their body sizes are smaller, it can impact them more significantly. And we know that hormone exposure has increased over a woman's lifetime as well. Now, the other things that are interesting are obviously more and more women putting off childbirth, mm-hmm. more and more women having fewer children, and a lot more women electing not to breastfeed. So put all this together, it's really created a trend where we're seeing a lot more earlier onset breast cancer than we used to before.
And talking about exposures, are there any deodorants and things that are linked to breast cancer?
So this is a huge question. My patients ask me this all the time because if you think about where the most common site of where breast cancer happens, it's usually the upper outer quadrant, which mm-hmm. is that part of the breast that's closest to the armpit. And we actually have a tail of breast tissue that extends all the way into the armpit. So for the longest time, people thought these deodorants, which are aluminum-based compounds, you put them in, they get absorbed through the pores, may actually be toxins that are leading to breast cancer. And the FDA, the CDC, and many other medical associations have really said that there's no compelling scientific evidence that deodorants are causing the breast cancer. Now, having said that, we haven't done a randomized control trial, meaning you get the deodorant, you don't. Everything else is the same when we see what happens. But at this point, I feel like women should feel comfortable wearing the deodorants without thinking that that's leading to breast cancer. Mm-hmm. But keep in mind, again, that the breast cancer can happen even all the way into the armpit. So that is an area that you should be checking on yourself.
And I have heard that a lot from survivors and stuff. They're like, oh, it was in my armpit. I thought, no, that's also something again, being your own advocate, doing your breast cancer screenings yourself, making sure you're getting that mammogram, knowing your risk factors. We've talked a lot about that.
Right.
And many of us know that we have to start getting the mammograms a little bit earlier. But how do we know if you need additional screening past that?
So there's 2 ways to know. One is if you have a family history. So this is the time to ask all the women in your life mm-hmm. if they've had breast cancer, or even perhaps ovarian cancer, or even some other cancer syndrome, such as there's syndromes called Lee-Fraumeni syndrome and such, where you can have other types of cancer, colorectal cancer and others. So if you have a strong family history of any type of cancer, even if you're a young woman in your 20s, it's time to sit down with your doctor and be thoughtful about a couple of things. One is, when should you start screening? Second is whether or not you should use any kind of hormone-related birth control pills. We know that a lot of breast cancers are related to hormones, especially the lobular breast cancer, because that lobular is the milk ducts mm-hmm. and the milk glands, and the ductal breast cancer is the ducts. Those are the roadways that carry the milk to mm-hmm. the nipple, basically. So the most common type of cancer is the ductal cancer, which presents with a lump. But the lobular breast cancer, which we're seeing increasing in younger women, the cells form in a line. So sometimes it'll just present with breast fullness. You won't necessarily feel a lump. And those are very much driven by hormones. So sitting down, if you're a woman in your 20s and 30s, talking to your doctor about your risk, and they may start screening you early. If you're someone in your 40s and you've started having mammograms and you have these dense breasts, then you need to talk to your doctor about either an MRI or an ultrasound. And the good news is, under Colorado statute, mm-hmm. all these screening tests are covered. So a lot of times patients come to me and say, I have a high deductible and I'm concerned about the cost of the screening. But really, in our state, we're lucky because they are covered under Colorado law. And so it's a cancer screening test that you should advocate for yourself if things don't show up on the mammogram because you have dense breasts.
And how can this affect our heart health as well, and seeing what's going on with our heart?
So this is really interesting to me as a cardiologist, because the mammogram, if you check a mammogram on a woman in their 40s, it can actually give you a picture of what might happen to her heart in her 50s and 60s. And the reason is because it's an X-ray of the breast. It has tiny little blood vessels. So if you have calcium deposits, which really are a marker of plaque in the arteries of the breast, that is almost like a crystal ball predicting the future, telling you that you're going to go on to potentially have heart disease or blockages in the big arteries around the heart and the ones in the brain that could increase your risk for heart disease and stroke. So what I do as a cardiologist, when I've had a woman who's had a mammogram, and every woman in her 40s has started having mammograms, look for something called breast arterial calcifications. It's usually in the fine print. It may not even be in the conclusion, but it puts a target sign on you that you're going to go on to get heart disease, and I need to treat you more aggressively. So as a woman, myself, I know when I get my mammogram, I look to say, does it say breast arterial calcifications anywhere? Because if I'm already starting to put down plaque in the small little arteries in my 40s, then by the time I'm in my 60s, I'm really a setup for having a heart attack or a stroke.
Wow. And like, is this kind of all a new technology, or?
That's the thing. We've been reporting on it for the last several decades. No one has paid attention. So this is why I want every woman to know 3 things from her mammogram report. Number 1, do you have a tumor, mass, any concerning findings? So that's actually looking for that cancer. Number 2, the density of your breasts, like we talked about. If you're dense, you need the second type of screening. And then number 3, are there any breast arterial calcifications? So that's a to-do list for every woman to know from her mammogram. I want you to know yours too.
Because we have heart disease, we've got all the cancers. Like it's my family definitely has a lot of these, and like you said, sitting down and talking to your family is huge because a lot of them, like I think for many years, like nobody really talked about it, and now it's good to know that history. And the older I get, and especially with having 2 daughters, I'm really, really wanting to make sure that I'm setting them up for a long life of health as well.
Well, and Jenny, we've been talking a lot about female breast cancer, but male breast cancer is a phenomena too. In fact, I lost a good friend from medical school to male breast cancer. It's very rare, 1% of breast cancer. But even men, I think, need to not think of this as a taboo, really feel their breasts and make sure that there's no lumps or masses or anything, and make sure that they're thinking about it.
And that's our Murphy Houston. He's a huge advocate for that too, because he survived it. And there is a good chance. And he said a lot of his friends were like, "What, you got breast cancer?" Like even that was his kind of first thing. But I feel like we all just need to be sure that we're looking for our body, looking for that mammogram, looking for those 3 indicators, and knowing what you're looking for is a huge thing too. And just being a little more educated on it and ask questions. Doctors are never going to get mad if you ask questions. I've learned that over the last couple of years.
Well, it's and when you're out with your friends, I've started doing this. Instead of us having cocktails, we're going to have something else. Or we'll go for a walk together. So really encouraging each other to cut down on the alcohol, to be active, to maintain our weight, to help reduce each other's risk.
Nice. Yeah. All right. Well, I'm going to need that friendship right now. All right. Dr. Cole, you can check her out, of course, on 9 News and Cherry Creek Heart in Aurora. Great time of the year to start thinking about it and actually doing an action plan for yourself.